These two dots are 5-day-old embryos about to be implanted into the womb of a 38-year-old woman. We're inside a Spanish fertility clinic where each year 300 British patients are treated for fertility problems. Here at the Evie Clinic in Madrid, the exterior looks like any other building. But human life is made in a lab here every day through pioneering fertility treatments. Nearly 50,000 British women a year have IVF, but many, frustrated with the postcode lottery that exists for treatment on the NHS, are now flocking to clinics like this one.
I would say that most of these UK couples, when they come here, or UK women, mainly they come for egg donation. Of course, some of them come for PGD or PGS or egg freezing or other different things, but mainly they come for egg donation, and here anonymity is a big issue. It's quite interesting because we have women in Spain who want to have an open donation and they go to the UK to do the treatment, and on the other side we have UK women who come to Spain because they want to have an anonymous donation and they cannot do it in the UK.
In the UK, the children of sperm and egg donors can find out their donor's identity when they turn 18, which has led to waiting lists of up to 6 months. But in Spain they're anonymous, and sperm and egg donors are readily available and can even be matched to a couple's ethnicity and colouring.
In Spain, it is based on the patient's physical characteristics. This is what Spanish law tells us to do, which means that we need to try to find the best match based on patient's ethnicity, hair color, hair type, eye color, skin type, more or less height and weight. Patients need to accept that this is somewhat different from, for example, is the practice in the United States, when you can choose personally from catalogues.
Evie runs 17 clinics across Spain, and their work has led to a number of landmark fertility breakthroughs. In 2007, Evie scientists in Spain were the first to introduce a groundbreaking method of egg freezing called vitrification or flash freezing. This maintains the quality of women's eggs far better than previous methods.
And the survival rate, which used to be 60 or 70%, became 95%. And the success rate is exactly as with fresh oocytes or with fresh embryos. So this changed completely the way we practice.
More recently, Evie scientists developed an incubation system that captures an embryo's moment-by-moment growth. This uses a time-lapse camera to photograph the developing fertilised egg every 10 minutes.
So instead of taking the embryo under the microscope, you can check every 10 minutes an image, and you can see the time-lapse motion next morning. So when you're not looking at the embryo, sometimes they do wrong things, wrong cleavages. And if you don't see it, you think everything is fine. But when you can check that and you can control for that, you can then select the best embryo with the highest implantation potential.